Module 2, force mismanagement, or as I like to say, the way you move matters. Same thing, but let's talk about this. This is perhaps the most overlooked concept of back pain that Gary Ward from Anatomy in Motion helped me to see. If you think about every step we take, we're vertical beings. We have a center of gravity and we have weight to manage within our base of support. Our base of support are our feet. So we have this vertical body that we're trying to move around in and out of spaces, run, jump, climb, lift, carry, twist. And we've got to keep that body vertical over its base. Each time we move, our center of gravity is moving within that base of support in different and varying degrees. The way our body is able to move around its base of support affects the distribution of force through the entire system. Force is distributed along fascia, through bones, around organs. We are perpetually managing force as we move. And when we get mismanagement of that force, we get areas or zones within the body that receive too much force, too much compression, or too much distraction. And with that, we develop tissue pathology. We develop sprains and strains when tissues are repeatedly asked to stretch open. And we create compressions, disc bulges, degenerative wear and tear changes when there's too much compression in an area. With our sacroiliac joints, we create compression or hypomobility on the side that's compressed. And on the side that has no force closure, we call it hypermobile, meaning it moves too much. It's kind of, it's a great system, but it's very much affected by, firstly, our feet, because they are the part of us in contact with the earth. They're like the foundations of this structure that we call our body. If our feet aren't aligned, then that affects our femurs, our thigh bones. Because they're connected. Whenever we turn a foot out, we affect the rotational angle of the femur in the hip socket. When we turn the foot in, the femur follows. Now, if we have femurs that are biased in one direction or asymmetrical in where they're pointing, then that affects the pelvis and its ability to move. There will be areas and movements it can't do because the hip is blocking it. And when the hip is blocking motion in a pelvis, then guess what? The lumbar vertebrae, and in fact the entire skeleton or spine, has to play catch-ups and create that mobility somewhere else. In our bodies, we either have too much motion or not enough motion going on if our force is not being managed beautifully. So, let's think about your original back injury. I like to have you think about a cut on your skin. Let's say you cut, maybe not the neck. I don't know why I went for the neck. Let's say you cut your forearm and you see it bleed. You put a Band-Aid on it, and guess what? It heals. It knows what to do. You just leave it alone for a little while, you protect it, and guess what? The body gets on with doing what it does. It heals. You don't even question it. You just assume it's going to happen. And that is what I assume when a back gets injured. I assume it's going to get better. But when I look at how someone moves, I can see that the way they're moving is completely reopening that cut every time they move. The tissues are getting either pulled open wide or squished together too tightly. And that will perpetually create a hotspot of stress and force, which even tissues who know what to do cannot do what they do if they're perpetually being poked or pulled excessively. And many of us are moving in ways that perpetually keep loading injured tissue. And we're wondering why that tissue doesn't get better. I can tell you that tissue is knocking itself out to heal, but the way you're moving is not helping it. And these are not the things that get better with strength. I hate to tell you. Strength is nothing, and stretching are nothing to do with what I'm talking about. I'm talking about the management of the forces. Sure, you can lengthen a tissue with stretching, but if the way you move perpetually alters that in the opposite direction, it's not going to stick. And yes, you can strengthen something that's weak, but if the way you're moving is not encouraging that zone or that tissue to load, it will never retain that strength. You'll be perpetually having to be playing top-ups to get it active. So that's why in my model, I'm really not that interested in strength and stretching. They're definitely part of the picture. Please don't get me wrong. But I see that there's so many people are trying that on a system that's not moving well. And that's highly ineffective. There's far simpler, far easier ways to affect our force management than strength and stretch. So what are they? Remember, we're not trying to fix anything yet, but I will invite you to have a stand up, barefoot preferably, and I want you to really look down at your feet. I want you to notice things like, where do they land in relationship to your hips? Do they land, or do you stand with your feet outside your hips? Or do you stand like a yogi and you have them neatly together? Do you stand with your feet pointing out? Do you stand with one pointing out and one forward? You will all have different variations. And all of those variations have different implications for the motion of the pelvis, which has therefore implications for the movement of your lumbar vertebrae. I would invite you simply to think of a movement that you know your back doesn't enjoy. And without changing anything about your default foot positioning, just do the movement within what feels safe. Please don't make anything worse, but just, do the movement. Maybe it's bending, maybe it's walking, maybe it's just standing. Just notice what your back's doing. Do your normal movement. Feel the same familiar sensation. And then try that movement again with any change in your foot position. Whatever comes to mind. So if you stand wide with your feet turned out, maybe you'll bring them together and turn them in. If you stand with one out and one forward, switch them. Simply do the opposite of what you normally do with your foot postures. And then very gently try that movement again just to see, has anything changed? Did the sensation intensify? Did it drop? Did it move somewhere else? Any change at all is feedback that you've just altered your force management. And if we can eventually understand these mechanics and we can learn which aspects of our alignment we can tweak to either take the heat out of a zone and move it somewhere else, then we have a new strategy, which is effectively altering how we move to take stress out of a spot that's doing its best to heal but keeps getting poked through an unconscious person moving in the same old way every day. I hope that's starting to make a little bit of sense. Remember, we're not trying to fix your posture. We're not trying to change your alignment. We're just trying to help you explore, do you have a force mismanagement issue? I could not tell you how many layers there are to these. Looking at a spine, noticing where it's moving, where it's not moving, inviting the tissue to open. It's a whole new learning. It's a conscious new way to move, and it's individual to you. There's no recipes. It's part of why I hate seeing 5 exercises for back pain on YouTube, because there's no way I would ever give 5 people the same movement prescription, because they're all doing very different things. And we're not trying to fix, we're just trying to become aware. Is this a possible issue that's keeping you in pain? Because if it is, and you're aware about it, like I keep saying, then the door opens to a way out. Hope that helped. Don't go changing too much. Don't try and force a new aligned pattern on a system that's under threat, because your nervous system may perceive that as yet more threat. But if you start to experiment with your foot postures and you notice the sensation feels better, then that's certainly something I would advocate you playing with. Small doses have massive impact. Even think about, as you stand there, do you load one foot more than the other? Is your weight shifted across to one leg more than the other? If you prefer landing on your right foot, the right side of your back will be compressed. Generally, depending on what your rib cage is doing. But just simple shifts of the pelvis, either too far forward, too far back, too far left, too far right, with a little bit of a belly button facing to the left or to the right, that's a pelvic torsion. All these things can be unwound once you know and are aware you're doing them. But they affect the force. And the message here is quality movement matters, and it has nothing to do with strength or length of tissue. It has everything to do with your brain's motor cortex and the default neuroplastic pathways of movement that you've laid down over the entire course of your movement life, which started when you were a baby crawling and rolling around on the floor. Some of these neurodevelopmental sequences were never put into your movement system. And this may be the time to start to recreate them, teach your brain new ways, and it's possible at any age. And that's the hope of this method. So quality movement matters. Have you got a force mismanagement issue? Your feet dictate what your hips are doing, which dictate what your pelvis can access, which dictates what your spinal freedom is. That's module 2 in a nutshell.